I'm John Lukeman. I'm a pediatrician with Warren Clinic. Been practicing for 3 years at South Memorial.
I'm Rowena Baumgartner. I'm a pediatrician at Warren Clinic, Springer, and I've been practicing for 21 years.
So many different ways that parents can pick a pediatrician. First, I'd say look online and look at reviews, because probably some of the most honest feedback people will give are on reviews. Could also call the office and find out if they do any prenatal visits, and go in and meet the pediatrician before. Some offices do that and some offices do not.
Yeah, and I also ask the parents to maybe ask their OB if they have any recommendations. And friends are a great source of finding out where pediatricians are in your area and ones that they would recommend.
I would say start looking for a pediatrician in the first few months of the pregnancy. It can be a longer process, especially if you go meet some pediatricians. But completely agree with you about talking to your OB and getting some recommendations.
Yeah, and I think it's also, like you said, it's important to try to meet with a few pediatricians. You want to find someone that you connect with and who you click with and who you're going to be helpful working with as a team. We definitely go to the hospitals to see babies. We typically will see the baby within the first 24 hours, depending on when the baby's born. And then we have you follow up with your pediatrician after you leave the hospital. And the pediatrician that may see you in the hospital may not be your desired pediatrician. It may just be the pediatricians who's on call for that group, but they'll take great care of you.
Whenever your children are admitted to the hospital, we have a great team of physicians at the Children's Hospital at St. Francis that will care for your child. They work closely with the pediatricians. Everyone shares notes, labs, imaging, and so there's great communication between the hospitalists and the pediatricians.
Yeah, and they're always very helpful with letting us know when a patient needs to come and see us for follow-up as well.
There is a seamless transition of care between patients that are hospitalized, whether it's in the newborn nursery or in the children's hospital, whenever they're admitted, and then whenever they're first admitted, pediatricians can follow along. All of that comes directly to their inbox, and they can follow it day by day and see exactly what's going on. Additionally, whenever a patient's discharged, the pediatrician can see that, follow the recommendations from the hospitalist, see when follow-up will be, and continue to manage care in an outpatient setting.
We typically recommend you see your pediatrician 1 to 2 days after leaving the hospital, unless it's a weekend, and then maybe 3 to 4. But we like you to follow up pretty quickly to make sure that the baby's eating properly and gaining weight.
So at a first visit, many things happen. First, the pediatrician will go through the hospitalization, make sure they're up to speed on everything that was done in the hospital, and make sure they know the full history of the baby and the pregnancy. Then the pediatrician will do a thorough physical exam on the baby and make sure the baby's growing well and doing well, and there's no abnormal findings on exam.
I also typically talk to the parents about how feedings are going, if the baby's having wets and dirties, and how mom is doing also from an emotional standpoint. In addition to asking moms how they're doing, we also do a screening tool at every visit on the first year of life to make sure that mom's emotionally healthy, and we can direct her to her OBGYN or her primary care physician.
So one of the things that we'll be discussing during the visit, if the mom is nursing, is how nursing's going, and if they're having any complications. We'll of course evaluate the baby to see if there's anything going on with the suck-swallowing coordination, if there's a tongue or lip tie, or any other abnormalities. And then finally, there are great lactation nurses with St. Francis, and they do a very good job at helping moms through breastfeeding problems.
And of course, we want to support moms with whatever choice they make, whether it be breastfeeding or formula, and to really help them make the decision if they're really having problems, what's best for the baby, and to know that they're being a great mom and they're going to do a great job with that baby.
Another thing that a lot of parents have questions about is sleep. Sleep for newborns is highly irregular and can vary greatly. Some newborns can sleep as little as 12 hours in a 24-hour period, and some can as much as 18 hours. Our goal is to make sure that a baby is sleeping well, feeding well, and doing well from the beginning. And then the pediatrician will continue to work with families and give recommendations to incorporate safe sleeping practices.
And we do recommend that babies be put on their back to go to sleep and not typically on their side or their stomach to prevent SIDS. And even though that sometimes is not the most comfortable position for the baby, it is the safest.
And we'll also add that a lot of times parents have questions about extra blankets, stuffed animals, and we recommend against any extra blankets, stuffed animals, or anything else in the crib to avoid any suffocation hazards.
Parents also ask us a lot about how much is too much crying. Babies do cry a lot, but they tend to have a fussy period in the afternoon and evening. If they cry more than 3 hours, more than 3 times a week, you might want to talk to your pediatrician about it. There's also several things that you can do to help a fussy or crying baby. Rocking, baby wearing, taking them on a car ride, or being safe and putting them in a bouncy chair or a swing that's properly equipped for a newborn is also very helpful. Parents a lot of times have a lot of questions about co-sleeping. Typically, we don't recommend bed sharing as there is a risk of suffocation from a parent rolling on the baby. There are certain devices you can buy that actually attach to the bed. The baby has their own area to sleep in, and those are safe. It's also safe for the baby to be in a crib or a bassinet in the room as long as the baby has their own separate sleeping area.
The American Academy of Pediatrics recommends against co-sleeping because it's one of the highest risk factors for SIDS, or sudden infant death syndrome.
Yes, and another thing you can do is to swaddle your baby to calm them down and help them get to sleep. If you have any questions about swaddling, I'd ask your pediatrician about safe swaddling practices.
One common question is, when do I call my pediatrician? And all pediatricians will agree that if your baby has a fever in the first 2 months of life, you need to call your pediatrician and let them know. Other runny noses and mild symptoms could probably wait until the next day, or could even be a good reason to reach out to your pediatrician via MyChart to ask questions.
Yes, that's actually a great idea. You can also call them during the day if you have a specific question or you have a more urgent question you need to actually speak to the pediatrician about. Most pediatricians have same-day 6 slots, so you can usually have your baby seen the same day if you need to. And then if your baby's sick in the afternoon or evening and the office is closed, Warren Clinic physicians are available by phone. We also have a nurse triage system that works. If you call our number, they can call you back and help direct you and decide what you need to do, whether it be to call a pediatrician, wait, or go to urgent care. I'm a huge believer in mom's intuition. If your mommy meter says your kid's sick, then call your pediatrician. And if either parent feels like the child is ill, especially in the first 2 months of life, if they take the temperature and it's more than 100.5 or more, they definitely should see the pediatrician or at least call the office to see where they should go.
You know, one thing that we're commonly asked is, what's wrong with my baby, or what's going on? And a common answer, unfortunately, is it's hard to diagnose the baby over the phone. So your pediatrician's answer may be to come into the office so that we can do a good history and physical exam.
I agree, John. It's really important to have your baby seen if they're sick. But sometimes if it's a mild symptom or something your pediatrician thinks that might be able to be addressed upon a video visit, you can always ask, and the pediatrician will decide if it's appropriate or not.
Another great thing that Warren Clinic provides is the new function of e-visits for older children. There are some specific e-visits that are particularly useful. One example would be conjunctivitis or pink eye. Another may be urinary symptoms, where the doctor may be able to review the questions that you answer and give a diagnosis through an e-visit.
The great thing about the St. Francis system is we have a huge network of providers and clinics that babies can be seen at. If it's after hours, we have some great urgent cares around the city. If your baby has a minor illness, our urgent cares are a great place to go. But if your baby's more ill, then you might consider going to the Pediatric Emergency Center. They're open 24 hours a day and have amazing providers who can take care of a variety of things, including trauma and severe illness.
Being a pediatrician with Warren Clinic, I'm particularly proud of our PEC. They do a fantastic job. I'm also very impressed with the Children's Hospital at St. Francis, how well they care for patients and what an amazing job they do. One of the great things about the Children's Hospital and the pediatric specialty in general with Warren Clinic is we really support the child and the family. We make everything child-oriented. We use bright colors, have games. Everything is lighthearted to try to make the experience great, not only for the patient, but for the nervous parents as well.
One amazing thing about our electronic medical record here at St. Francis is we have the capacity for parents to ask questions to their pediatricians through MyChart. It's a really great tool to be able to ask non-urgent questions to your pediatrician and not have to wait on the phone and not have to be put on hold if it's a really busy day at the office.
The guidelines for pediatric vaccines are very straightforward, and there is significant research that shows vaccines are very safe for children, probably more research than most aspects of medicine. And we strongly recommend vaccines with the Warren Clinic. There are some minimal side effects that children can get with vaccines, including some low-grade fever, maybe some fussiness or irritability for 24 to 48 hours after vaccines.
In the first year of life, we see kids a lot for well checks, and at those visits we'll address behavioral, feeding, and also vaccines like we've been discussing. There are a lot of vaccines in the first year, but the American Academy of Pediatrics is pretty straightforward on what they recommend, and they do recommend a specific time between vaccines and how frequently you come see your pediatrician to get vaccines. So listen to your pediatrician, and we would recommend that you follow the vaccination schedule. And if you have any questions, please feel free to ask your pediatrician. They'd be happy to answer any questions at any time.
I completely agree, and I would say vaccines is one of the most common things that I get asked about, and pediatricians are happy to answer those questions because we know that parents have questions and concerns, which is completely appropriate, and we're happy to help you feel better about vaccinating your child.
Parents also ask a lot, what kind of medicines can I give my baby? There are a few that you can use. Tylenol is safe to use, but I would recommend that you talk to your pediatrician about dosing because it's based on weight and not age. It also isn't recommended to use ibuprofen before the age of 6 months. Also, saline and suction if your baby has a runny nose is also helpful. But most other medications under the age of 4 are not recommended, especially for coughs and colds or other minor ailments.
So many people have questions about how often their baby should poop or what the poop should look like. Babies can poop as little as once every 3 days and as much as 10 times a day, if not a few more than that. Baby poop starts off as the meconium, which is black to dark green in color. Baby poop can vary depending on what the baby's eating, whether the baby's breastfed or bottle fed. So ask your pediatrician if you have any questions.
One thing you might want to look for is if your baby has a poop that is white, black, or has blood in it, then you definitely should call your pediatrician and ask if they should be seen or what you should do next. Parents do ask a lot about bathing. What's normal and how often should I do it? Typically, we recommend bathing every couple days, but it can be more if the baby has soiled or had urine on them that you need to get off. The other thing that's really important is that your baby's skin is very sensitive. We don't typically recommend any highly scented soaps, lotions, or cleansers, but something that's fragrance-free and gentle for your baby's skin. In light of 2020, everybody has many concerns about COVID and what should I do with my newborn and how should I be concerned about it. It's really typically like any other illness. You should be careful if the baby seems fussy, coughing, stuffy nose, or has a fever. And you should treat it like any other illness and ask your pediatrician if they need to be seen. It's really important that you are careful around people that are ill. And we typically don't recommend that the baby be around anybody that's having any cold or COVID-like symptoms or fever. And of course, good hand washing.
One thing I'm saying a lot right now is treat this like a flu and RSV season with coronavirus out there. So be cautious with who you're around, especially with your baby that's under 2 months old. RSV is respiratory syncytial virus. It's a virus that causes significant difficulties in babies because it can cause a lot of congestion, cough, and difficulties breathing.
Yes, and it's really important that if you have any concerns about your baby's breathing, especially in the winter or if they have fever, to make sure you call your pediatrician or just make an appointment and have the baby seen if you're very concerned. We as pediatricians work pretty closely with OBGYNs and we make a great team, but sometimes moms have questions about themselves. If they do have questions about themselves, we do recommend they speak to their own physician, although we're happy to help direct them if it's a specific or even a general question.
Parents often ask what resources they can use to find trustworthy information about their baby or child. I commonly recommend the AAP, which is the American Academy of Pediatrics. They can also use Safe Kids, which is a great resource, or healthychildrens.org.